Hi, this is Rich Sanders with Southern Health Lawyers, and this is the Health Law News Nugget for May 1st, 2018. Well, CMS was busy last week in releasing guidelines for inpatient services payment by Medicare in a multi-page rule that it typically releases this time of year. The IPPS proposed rule is kind of standard process for CMS in hospital compensation methodologies. The interesting thing for News Nugget watchers, though, who are both hospital administrators and others in the healthcare industry, including physicians, pharmaceutical representatives, and practice administrators, is that inside this IPPS proposed rule, CMS fundamentally changed the Meaningful Use Program. The Meaningful Use Program, of course, is a set of rules from 5-6 years ago that included the incentives to adopt and meaningfully use electronic health records. Now that I think about it, it's even older than that. But in any case, the Meaningful Use Program has led to hospitals and physician practices all over the United States using EHR technology that they had not heretofore done. So this Meaningful Use Program is an important part of doing business in healthcare over the last decade. The proposed IPPS rule from last week, though, fundamentally changes the Meaningful Use Program. Frankly, strikes the meaningful use term altogether. The proposed rule will now refer to this set of rules as promoting interoperability. It's a tough mouthful to say, but the promoting interoperability rules will focus on the meaningful use rules as a foundation, but revise them in some substantial ways. The first is they'll be changing the scoring methodology and making it easier for hospitals and physician practices to meet the old meaningful use requirements, now promoting interoperability requirements. The second, and of course this is a theme that y'all have been hearing about on the News Nugget throughout the year, opioid prescribing technology and the way that technology will be used to help limit opioid prescriptions and control the epidemic in our country are a part of these new promoting interoperability rules. And then finally, consistent with that theme, any measure that doesn't relate to interoperability, CMS is proposing to strike from the old meaningful use rules. So it's a new game in town, and yet another indication that this administration and Seema Verma, the new CMS administrator in particular, are looking at different ways of doing business in healthcare. Finally, and maybe most interestingly to all members of the audience for the Health Law News Nugget, is that buried deep in the IPPS proposed rule is a change to some agency requirements on requiring pricing transparency for healthcare providers, in particular hospitals. More news on that later as CMS is just gathering comments, but part of the Trump administration's policies on making it easier for people to access their patient information and promoting transparency in pricing in America is buried deep within this rule as well. Thanks so much for watching the Health Law News Nugget this week. Look forward to seeing you again next week. I'm Rich Sanders with Southern Health Lawyers. Bye-bye.